Welcome to the first video and lesson in the Springfield Empowerment Zone's Science and Humanities curriculum. In the weeks ahead, we will be studying and analyzing complex issues that exist in the United States using both science and humanities to guide us along the way. The goal of these lessons is to go beyond what we may typically study within the classroom and look deeper into the issues facing our communities. Over these next few weeks, we will address topics through the context of intersectionality, which allows us to understand issues based on the unique identities within our society. This focus will move us away from a one-size-fits-all and often academically dishonest model of education and serve to highlight different topics from the unique perspectives and reflections of our own communities. Intersectionality is an inclusive approach that will ensure we confront complex issues through a much more diverse lens. Each cultural experience in our country is unique and varying based on one's individual identity. A Black man's life experience is different than the way a Latina may experience the world. A Native American woman's understanding of this country may be vastly different than that of an Asian gay man. Various contributions to one's identities, such as race, gender, sexuality, religion, disability, and many others contribute to our overall worldview and experiences with the institutions that exist in our local community, our state, and our country. Moving forward, we will study and analyze key issues through intersectionality, with the disciplines of science and humanities as our guide. This week, we will begin with the issue of poor access to healthcare and healthy food within our community. We will review the issue at the state and local level. Our objective will be to recognize the disparities that exist and how they contribute to poor health and early causes of death within Springfield and Massachusetts Black and Latinx communities. Since the earliest days of the coronavirus pandemic, report after report has explained the terrible impact the virus has had on Black and Latinx communities in the United States. The link between the virus's effect on the most medically vulnerable in our society has become clear. COVID-19 exposed health and medical disparities that have always existed in the Black and Latinx communities long before COVID-19's infiltration. Like so many other locations within the United States, Black and Latinx populations in the state of Massachusetts and including our very own city of Springfield have long faced many of these same health disparities and are continuously plagued by the social, political, and economic factors that prevent true progress towards health equity. When evaluating factors that contribute to public health data and potential disparities, public health experts and sociologists consider several different factors that contribute to those disparities. Factors such as education, income, employment, community safety, physical environment, access to care, and many others must be evaluated. One of the most prominent factors that can contribute to poor public health policy is income. The city of Springfield has one of the lowest median incomes in the state of Massachusetts. In Massachusetts overall lies a clear income gap in the Black and Latinx population when compared to the income of white and Asian communities. As is the case in the rest of the country, that income gap leads to increased inequity in various measures, most obvious being public health and access to care. As of 2019, the Black and Latinx community in Massachusetts had the most difficulty gaining adequate access to preventative and routine health care when compared to other groups within the state. Gender, age, and income also played a significant factor in one's ability to access care, once again highlighting the role of intersectionality in everyday life. This is just one example of the disparities that exist in Black and Latinx communities that prohibit the same standard of health many Americans take for granted. As the topic of healthcare remains such a heated political issue, Black and Latinx communities remain vulnerable due to lack of adequate care. Limited access to healthcare is just one obstacle for Black and Latinx communities. One of the most overlooked and perhaps most controllable factors contributing to poor health in these communities is access to proper food. Access to healthy food and nutritious food plays a vital role in the health and well-being of all humans. However, access to that food is often severely limited or non-existent to many Black and Latinx communities. Low-income communities in various areas throughout Massachusetts have little to no access to full supermarkets in their neighborhoods. This includes Springfield, where many Black and Latinx communities are identified as food deserts. Studies continue to show that access to poor quality food and a diet dependent on processed, less nutritious food options available in the small convenience stores and fast food restaurants located throughout these communities leads to a number of chronic health conditions. Ailments such as high blood pressure or hypertension, heart and cardiovascular disease, and diabetes continues to plague Black and Latinx communities. In Springfield alone, the rate of hospitalization due to cardiovascular and diabetes-related complications in Black and Latinx communities soars well above the rates of their white counterparts. Additionally, unhealthy eating and other habits continue to contribute to chronic lung conditions such as chronic obstructive pulmonary disease or COPD and asthma, affecting the Black and Latinx communities at a higher rate as well. All of these conditions lead to only one thing: an increased rate of Black and Latinx citizens in Springfield and Massachusetts dying at much younger ages than they should be. Ultimately, Springfield and Massachusetts serve as a microcosm of the health disparities facing Black and Latinx communities throughout the country. Issues like access to health care and access to healthy food are just two of the numerous public health challenges facing people of color. This challenge existed well before COVID-19, and unless they are addressed, they will exist well after the pandemic. So as you move into this week's schoolwork, do so with the focus and vision that will help create solutions for these and many of the other issues we'll be facing in the weeks ahead. Thank you for joining us.